abnormal hand appearance with persistent space between the long and ring fingers. Bowed legs. This is a condition in which your legs appear bowed out, meaning your knees stay wide apart even when your ankles are together. Bow legs can sometimes be a sign of an underlying disease such as Blount's disease or rickets. And in the long term, this can lead to arthritis in the knees and hips. Decreased muscle tone or hypotonia, commonly known as floppy baby syndrome, is a state of low muscle tone. Hypotonia is not a specific medical disorder, but a potential manifestation of many different diseases and disorders that affect motor nerve controlled by the brain or muscle strength. Disproportionately large head to body size difference. This is evident in dwarfed individuals along with their disproportionate limbs. Prominent forehead or frontal bossing is common in individuals suffering from dwarfism. Their facial features are also affected. Shortened arms and legs. This is prominent especially in the upper arm and thigh. The foramen magnum, or the large opening under the skull, may need to be surgically enlarged in cases of severe narrowing or stenosis and compression of the spinal cord. When this opening is too narrow, the blood vessels and nerves are compressed, which can lead to central apnea or the loss of breathing control. This is responsible for the risk of sudden deaths in infants with achondroplasia. The back of individuals with achondroplasia can develop a smart sway, or lordosis, to the lower back, while abnormalities in the mid-back may cause a small hump, kyphosis, and compression of the spinal cord in the dorsals. The spinal cord compression can require surgery to decompress it. Orthopedic procedures may be performed for lengthening of the limb bones and correction of bowed legs. This is usually done after full growth has been achieved. Surgery, or lumbar laminectomy, is also indicated when the spinal stenosis or narrowing causes symptoms which tends to be evident in young adults. Pregnant women with achondroplasia should have their babies delivered by cesarean section due to their characteristically small pelvis and high risk of birth-related trauma. Dental crowding is also common. The teeth should be straightened and, if necessarily, removed to alleviate this problem. The control in obesity is essential, and obesity can be a significant problem in people with achondroplasia. When obesity is present, the back and joint problems that are characteristic of this condition worsen in severity. That is why diet and exercise is highly recommended. Treatment with human growth hormone, which is still considered experimental, has been preliminarily reported to increase the growth rate after treatment. But studies have not yet demonstrated that adult height is increased by this treatment. Little People of UK. This organization campaigns to ensure that all little people are portrayed in the media in a positive way. National Organization for Rare Disorders, or NORD. This is a patient advocacy organization dedicated to individuals with rare diseases in the organizations that serve them. NORD, along with its more than 260 patient organization members, is committed to the identification, treatment, and cure of rare disorders through programs of education, advocacy, research, and patient services. Little People of America. Little People of America Incorporated is a national non-profit organization that provides support and information to the people of short stature and their families.